Hi folks, I'm Mayor Kim Driscoll, and thanks for joining us today as we talk about Salem for All Ages, our city's age-friendly initiative. We're so honored and proud to be only the third community in Massachusetts to be designated by the AARP and the World Health Organization with our age-friendly designation. This certification really showed that we're the type of community that wants to make sure we have an active environment for people to age in place. It also signifies that we want to provide good opportunities for good health, inclusion and access, no matter your age. And we've worked hard over the last several weeks and months and years as part of our Salem for All Ages initiative. And I'm so pleased to be joined today with our two co-chairs who led up this initiative, Patricia Zaido, former director of the Salem Partnership and longtime Salem State University professor. So long it goes back to Salem State College.
That's
where,
right.
You worked and I graduated.
At least I wasn't there for the normal school.
Exactly. And the other co-chair is Dominick, the chief of staff in the mayor's office. And the two of you have been a dynamic duo, really leading this issue in a way that ensured we brought our community together and that we prioritized it. And so grateful that we could spend a few minutes really engaging with individuals about why this is so important and the incredible work the two of you have done leading a team to ensure that Salem is a place where you can age in place. So Patricia, maybe you could give us just an overview of the action plan, the process, and the certification, because it's a big deal. We were only the third community, and I think it signifies that there's some work involved and there's some real intentionality. And now we know there are others, but still we were an early adopter of this.
Thank you, Mayor Driscoll, and thank you for doing this. Yes, the World Health Organization created this age-friendly initiative, and when they did, they based it on what they called 8 essential features. And they communicated with 22 cities in 33 countries to come up with these features. And they're features that we would expect: health, transportation, housing, but there are others that we wouldn't expect: social participation, outdoor spaces, inclusion, etc. So in 2015, not 2005, but 2015, I read about this initiative and that it was being looked at across the country. And it kind of fascinated me because I had resigned or retired from the Salem Partnership, and 6 whole weeks had passed and I hadn't talked to you. And so I went and met with you. And you were your usual enthusiastic self who said, "Oh, this is a new initiative? This is a creative adventure? Let's do it." I was stunned. I said, "I don't know anything about this. I just read it in the newspaper. I have to do my due diligence." And you said, as you normally would, "Do your due diligence and come back and we'll do it." So I did just that. I came back. And you were the one that said, "Let's call it Salem for All Ages." And I thought that was a great idea. And the reason for that was because, think about it, if you put in a park bench, it's good for an older adult, it's good for a woman with a baby carriage who wants to sit down for a minute. And certainly a good health system is beneficial for everybody. So I asked you for 2 things that day. I asked you
Only two? Only 2 things? I think it was only 2,
That was
right?
just that day.
Yeah, exactly.
Okay. So I asked you if your chief of staff could be my co-chair. I explained that my reasoning was that I wanted to give this project, this initiative, credibility. And if the mayor was allowing her chief of staff to be the co-chair, then everybody, I thought, would sit up and take notice. Dominick was there, and he said he would agree to do it. And I said to him, "I really don't expect much from you. I really just, want to use the name of the mayor's office." I really didn't know I was lying, okay? But the truth of the matter is, I have been the face and the voice of this for 7 years now. Dominick has been the backbone. There's no way that I or anyone else could have accomplished what we have if we didn't have his knowledge, his enthusiasm, his work ethic. I could go on, but I won't. The second thing I asked for was a consultant. And I think I put it pretty directly. I said, "I don't know what I'm doing." And so you came through again And we hired Dr. Caitlin Coyle from the University of Massachusetts Gerontology Institute. And she really was already knowledge about age-friendly. But we had to ask ourselves, do the people at Salem really want this? So we did a needs assessment. We did 6 listening sessions, and everybody was stunned because well over 100 older adults showed up for these, okay? We did 3 focus groups, one with regular citizens of Salem, one with city leaders, and one with city department heads. If we didn't have the department heads with us, we couldn't have done this. We also read existing plans that the city already had in place, 15 of them as a matter of fact, including a new one on Park and Rec, and we were able to incorporate this and work together on that. The last thing we did, which was the most important thing, we did a survey. Everybody told me I was stark raving mad because I had 60 questions on this survey, and I told them if it was 8 or 10 questions, I didn't want to do it because you can't learn anything from that. 446 people did that survey and not only answered the questions but had many comments, including this survey is too long. And we read all of those comments, and I would say that that was the major thing we based our action plan on. We drafted the action plan and we presented it to AARP, who was at that point representing the World Health Organization in the United States. They not only accepted it, they put it on their website as an example of the way to do an action plan. On January 19th, 2017, notice I happen to remember the date, Mike Fester, who was and still is the executive director of AARP Massachusetts, came and gave you a certificate of classification that we had an action plan and we were ready to go.
We're an age-friendly city.
No, we were starting to learn how to do it.
We're at the beginning of becoming an age-friendly city.
Yes.
Well, I can't say enough about the work that you did, both identifying this as something that would be useful in our community, putting the building blocks together, and coming in and making it happen. But for you, I don't think we'd be as far along as we were, because we weren't really aware of what this meant. We knew it was true to our values. The thing that appealed to me during those conversations are, we are a place that we want to welcome and work for all, and this was certainly aligned with that. We had a number of plans. We're big believers in plan the work the plan, whether it's park, rec, and open space, how we think about our economic development activities downtown. You had been engaged in a lot of those efforts, and this was sort of next. And the last piece was we were in the throes of trying to build a new community life center, and what do we want it to entail, right? Our fastest growing population are our older adults. How do we make sure as we think about this new facility that we were hoping for and working toward, that would also incorporate some of these principles? So it was a really important time and definitely wouldn't have happened without you pushing, cajoling, convincing, and working on it. And couldn't agree more, having Dominick as a co-chair. He's the backbone of so much of what happens in Salem. Both the work ethic, the smarts, and the know-how has kept us going in a lot of different places, not just in this one. But maybe we could talk a little bit about the actual work, right? So we had a task force. We really leaned into our community to help with implementing this idea of what does it mean to be an age-friendly city and how do you achieve that?
Yeah, I think that to Patricia's point, the last 7 years, it's really been a pleasure and a privilege for me to work with her on this endeavor and to work with all the different participants in the task force and the subcommittee. So we approach this, as Patricia mentioned, really with a kind of a whole of government approach. We sent the message to the departments that this was a priority. This was kind of a cross-departmental initiative. And we structured it, the work around the action plan, looking at those 8 domains of the age-friendly city that Patricia mentioned. We set up a task force that was comprised of board members, city department heads and staff who worked in those areas that intersected with the domains. And we invited in stakeholders and members of the community from organizations that also worked in those spaces. And then we broke the task force up into subcommittees focused on the domains that were priorities identified from the needs assessment and from the leadership council that we had.
Yeah, maybe we could talk a little bit about that leadership council, because
Yes.
we are a community. I always say Salem punches out of its weight class because we have such great partners, and I think we really wanted to take advantage of that as part of this leadership council. Could you talk a little bit about that, Patricia?
Yes, we put together the Leadership Council for, I'd say, 2 or 3 reasons. One, we certainly wanted to know the movers and the shakers in Salem, to know what we were doing. Secondly, from a very selfish point of view, we wanted them to know so that when we came and asked for help or advice, etc.,
Or money.
or money. No, I never asked for money. When I left for Salem State, I decided I was never going to ask for money again.
True.
So I'd done that all my life in nonprofits. So anyway, we made sure that they knew what we were doing, and we had them meet twice a year, and we kept them up to date on everything, and also we got insight from them. They told us, I think we should go in this direction or that direction, and their advice was invaluable.
Yeah, I think so many of the policies that we sort of laid out as a community came from some of the information we have. I mean, Salem Skipper, our rideshare service, really started as an age-friendly initiative. We know it's working for everyone. But maybe, I touched upon one, but we could talk a little bit about some of the successes that we've seen as part of this initiative, and maybe Dominick, you could share some of your thoughts there.
Yeah, I mean, I'll start with the first priority that was identified in the survey that Patricia mentioned, and that really came out of the focus groups during the needs assessment, was this issue around isolation. So we decided to focus on domains that would help address connection between older adults and the rest of the community and the many assets and resources that were available to them here. So that took really 2 different aspects. The first was a focus on the domain of information and communication. We moved quickly to set up a website, worked with Sperling Interactive to set up what is a really comprehensive website that has lots of information, salemforallages.org. Check it out if you haven't yet. It's not only information about the initiative, but also community resources, other programs. There's a calendar of events that pulls in information from all different entities in the community. So it's a great resource for people to check. We set up a Facebook page to also share information through social media. And we created a resource guide that exists both in digital format and in hard copy that's updated annually in English and Spanish. When a Salem resident turns 65, they receive a copy of the resource guide in the mail, so they know what kinds of services and programs are available to them, so they can age in place here in the community. And the other aspect of connection around communication was an existing program called Salem Volunteers. It was run by a Salem resident who himself was a volunteer and had devoted a lot of time and energy into it. He worked with us to upgrade that website, salemvolunteers.org, to become like a one-stop clearinghouse for people that were looking for volunteer opportunities right here in the community. And then the other element, the other domain that the subcommittee focused on was was around transportation. And the idea that in order to help people get to these amenities and resources and programs, that they might need assistance finding their way there. And we, as you mentioned, we applied to the Tufts Health Plan Foundation for a planning grant. We received that and conducted a study about this concept of crazy innovative concept around on-demand ride share. So something similar to Uber or Lyft, except as a public enterprise, it would be very affordable rates, $1 or $2 for a fare for a ride, as a way to provide a connection for people that didn't have a car, felt uncomfortable driving, and it's really, as you said, it's really taken off. Ridership's over 115,000 rides since we started the program in December of 2020. If you look at the cost of an average ride for Uber versus the cost of an average ride on the Skipper, that 115,000 rides means that Salem passengers have saved over $1 million on transportation. And that's a program that I think it's been very successful, and we're hopeful that it can continue and expand and strengthen in the years to come.
And talk about the For All Ages part of Salem For All Ages. We know that Salem Skipper is serving young adults, high school students, even middle school students who might be going to work or needing a ride, as well as older adults, some of the more vulnerable members of our population who aren't able to drive, and then folks who don't want to drive. It's been a complete home run, and it all started with this idea that we need to be able to get folks around a little bit better. I think one of the key parts of the initiative that I always think of is, just the way we leaned into ensuring the health and welfare of residents during COVID. Like, we never would have thought we would be having a pandemic. And there we were trying to understand how we could best support residents in our community, and we had this Salem for All Ages platform already in existence, and I think we really put it to good use. Maybe Patricia, you could talk a little bit about how this initiative helped us during COVID with some of the connections we needed to make as a community.
Well, I think that brings us to health, which
Yes.
is obviously
Yes.
a big issue. And this subcommittee focused on preventive health. The American idea of health is based primarily on curing illnesses, which is certainly a good idea. But I think the other half of it needs to be looked at more seriously, which is how do we prevent illnesses, particularly in the older populations. We did things like bring in physicians from the North Shore Physicians Group who talked about how to avoid getting a stroke, how to deal with diabetes, etc. We focused on things like diet, nutrition, walking programs, also volunteer programs to bring older adults to medical appointments. For example, with the colonoscopy, you're not allowed to drive yourself home.
Right.
So, and you're not allowed to get a cab either. So somebody has to be responsible, and that has been very successful. You mentioned COVID, and that's one of the things that we all had to do was shift, and we certainly shifted our action plan. We started talking about gardens. So we have the wonderful garden at Mack Park. We had raised gardens at the Community Health Center where the older adults can dig in the dirt, which is always a good thing to do. And during COVID, for example, we suddenly realized the term food security was very, very important, and that food pantries. One of the things that Salem did that I had very little to do with, but we were involved, was that we called up every single Salem citizen who was 60 years of age or over and made sure that they were okay. I talked to one woman and she said, "Oh, I'm fine, dear." She said, "I have a couple of things in the freezer." Within 1 hour, she had things in her refrigerator and things on her shelves. She was the only call of 30 or 40 that I made that really needed help. It proved how important what we were doing was. And so those are some of the things. Preventive medicine is what we were really after.
If I could just add to that,
Yes.
the Salem Together initiative during COVID, which Salem for All Ages was part of that. It was a larger community effort to check in on older adults or people who may be isolated or medically vulnerable and at risk. Was a phenomenal operation, and the credit goes to a lot of people, and I especially want to give credit to Terry Arnold and the social work team at the Council on Aging, who did so much work during that time to connect with the older adults in the community that they regularly would serve at the CLC,
Right.
And just to check in with them. There was, I think, and the
another
hundreds of
component.
volunteers who made those phone calls too.
Yeah.
There's another component. I forgot about this because we did this in the first year, but we put together Are You Okay? With the police and fire department for the most vulnerable in the city who are homebound, et cetera, and they would get a phone call every day. And if there was no answer, there's a lockbox at their home, and the police went over. And that, I think, is vitally important. Thank you for reminding me of that.
Yeah, we have so many good stories that came out of that. That Are You Okay program, we heard from an adult daughter of an older woman who lives in Salem, who lives by herself. And she lived out of state. She couldn't be here every day, and she took such peace of mind in knowing that her mom was going to get a call, that if there was a problem, the police could enter. And sometimes it was just about something small, but the fact that she could find a way to make sure, her mom was safe at a time when she couldn't always be there. She let us know how meaningful that was to her. I know during the phone calls during COVID and the Salem Together initiative, beside needing something, did you need something from the grocery or a ride somewhere, people really appreciated the conversation.
Absolutely.
And so there were, the old days you might have a pen pal, this was a phone pal that you got a call from to check in and, have the ability to have that human connection that sometimes we really struggled with during COVID. So those are just ways that I think this initiative helped us think differently and better prepared us. We didn't know, obviously, we were going to need those sorts of that infrastructure, but it really gave us a chance to fly. I think the other area that's been really key for us here is housing. Such a tremendous challenge all over Massachusetts. Over 50% of our renters in the Commonwealth are paying more than 30% of their income towards housing. We know that's also the case right here in our city. We've done a lot of important work trying to address our housing challenges, but wonder if we could just talk a little bit about the role that Salem for All Ages has played within that effort. Maybe Dominick, you could start.
Yeah, I mean, for sure, as you mentioned, the housing challenges are significant in Salem as they are throughout the Commonwealth and many places of the country, and we've worked pretty intentionally throughout your administration and particularly over the last several years to try to put in place those structures and policies that allow us to help moving towards right-sizing our housing supply. And that work's still going on. Salem for All Ages has been engaged in a few of the larger efforts around housing in the community, and I think two of them that especially come to mind. The first is accessory dwelling units. These are in-law apartments, granny flats, which is not a great term, but the idea that it is a part of a house that is a separate unit that doesn't consist typically of a separate structure. Sometimes it does. One bedroom or studio, very small and naturally affordable. And the AARP has long regarded these as a very age-friendly, they've endorsed these as a very age-friendly approach to housing because they allow an older adult who's a homeowner to derive some additional income from their home, which can be helpful if they're living on a fixed income. Or alternatively, the older adult homeowner can live in the ADU and rent out their house to a larger family that might be struggling to find a larger house to live in with more bedrooms. So it allows them to stay not only in their house, but also in the community where they've lived and where they have roots. Our previous zoning was pretty restrictive around accessory dwelling units, and there was a diligent campaign with the City Council and with partners in the community, including Salem for All Ages, to try to persuade people that this was a common sense approach to solving our housing challenges. It wasn't going to do it all by itself, but was a part of the larger puzzle that we thought was really important to advance. And that change to the zoning has happened, and now we're working to create programs to help encourage homeowners to explore this opportunity as a way to age in place, not just in Salem, but in their own homes.
Yeah, it's certainly also, I think Salem became a leader around this issue, and we're seeing so many other communities now adopting ADU ordinances as of right. We've seen whole states take that on as a means to try and address some of the housing crisis, but ensure that we have the type of housing we need when you have an older adult population and young families and young adults and a range of people. You want to make sure you have all kinds of different supply. So more to come on that front, but really important that we had some tent poles there. I think the other subcommittee that I always found to be welcome and almost a natural fit here in our community and so necessary is when we think about social inclusion. The World Health Organization has obviously really identified the idea of social participation and inclusion being a real key as folks are aging in place and older adults really wanting those opportunities. Can you say more about what we did in that regard?
Yes. Interesting when we did that survey and when I was first beginning this initiative, if you'd asked me what's the most important concern that older adults have, I would have said, well, maybe financial or health or housing. But Dominick mentioned it. It's isolation. It's loneliness. It's being totally removed. I had comments like, I was a CFO and my opinion used to matter. Nobody cares what I say, and I don't even know what's going on. And since then, it's been interesting because this has been in the media often because it's been proven that this leads to depression and to early deaths. So you're right, this is a very, very important initiative. And we did intergenerational things. The health studies students at Salem State had a rec day for students and older adults. We also worked with the YMCA with their after-school program with older adults reading. That was, of course, before COVID. And we also are doing two new things that I think is really important. We've just completed our second pilot program on tutoring in technology. What we've found is quite interesting is that many older adults use social media and internet like any other age group, and that the stereotype that they don't is not right. But there's also a group who have an iPhone and maybe even an iPad or a computer, but they either use it as a regular phone, or they only know how to text, or they use email but not so much. And then there's a group who really has no concept whatsoever. And you know, when this started, all this social media, et cetera, it was kind of, I don't want to say a luxury, but it wasn't a necessity. Now it's a necessity.
Right.
With North Shore Medical Center, if you're not on Patient Gateway,
Right.
you got a problem,
Yep.
okay? If you want to buy tickets or you want to do just about anything, they say to you, do it online. So we've run these 2 pilot programs, and they've been highly successful. But I'm meeting Monday, as a matter of fact, with the tutor, who has been terrific, because we're getting success, but with too small a number, and it's costing more money than we should have to spend. So we're moving forward with it, but we're changing the process a little. The other thing is quite interesting. We won a grant from AARP, a small grant, to buy 10 signs. And the signs say, "Happy to chat." We put them on one bench in the 10 major parks, and it, as I said, says, "Happy to chat." You're invited to sit down and talk. This is certainly a way to be able to help eliminate loneliness, etc.
It's an icebreaker. It's an
Yes,
icebreaker, right?
Well, it's gone viral.
Oh, good.
The Boston Globe wrote an article on it. A radio personality who does a morning program brought his program here. He sat on the bench in the common and invited everybody to sit down. So little things are very important too.
Yeah, that's a really good point. And as you've pointed out, like ageism still exists in many places, and everything we can do to combat that is sort of built into what you just talked about, from the inclusion and the social aspects, but also the accessibility. You know, Salem's a historic city. We pride ourselves on our history. We've got historic infrastructure. You know, this, I think, effort around Salem for All Ages also, I think, had us cued in a little bit more to the accessibility challenges and what we can do about it. Maybe, Dominick, you can share some of the thinking that went into that aspect of the work.
Sure. So one of the first things we did in 2017 was we invited Valerie Fletcher and her team for the Institute for Human-Centered Design to come to Salem and do a few public symposiums or presentations about the concept of universal design, which is the idea about renovating or building buildings in a way that can be accessible to people of all abilities and all ages. And they were incredibly well attended by city board members, staff, builders, just general members of the public. But we also had work to do on our own. So we have what's called an Americans with Disabilities Act transition plan. And in Salem, our ADA plan was relatively out of date. Only about half of the communities in Massachusetts have an ADA plan. But it was an eye-opening opportunity for us to invite the Institute to come back and work with the city in partnership in updating that plan. And it went from being just a couple of pages to being this really robust document outlining many of the opportunities and needs that the city had to tackle to help improve accessibility. And we didn't just create the plan, we then, as a city, embedded that in our capital planning work, in how we provided updates on our website and social media. Even the policies and practices around our public meetings became informed around the updated ADA transition plan, and it's still part of our capital planning process every fiscal year.
Yeah, and small things made a big difference, from listening devices for public meetings to how we think about our historic sidewalks and the way people get around. So lots of work to do in that regard. You know, honestly, we just touched upon a few of the items that this plan and the work that's been in place over the first 5 years of the initiative. This 5-year period, it ended in 2021, and I know AARP was really impressed with our final plan and all the progress we made, and they've used it as an example for many other communities, which is always a source of pride as a place that's, if you're interested in exploring an age-friendly certification, look at Salem. But I'm curious, what do you think comes next? How does the initiative keep going after this 5-year period? Maybe you could talk a little bit about that, Patricia.
Absolutely.
Since you got us into all this trouble. Right?
Oh, I've only begun. Actually, we had learned a lot, and we knew that we didn't want to do another 5-year plan with this task force. We'd done a great job, but we needed to look at it at more creative and innovative ideas. And we actually knew that we had to get more specific in terms of Salem. We now knew what Salem really needed. So we picked 4 initiatives, and we put a specific committee for each initiative. And I'll talk about the first two, and then Dominick can give us the last two.
Great.
The first one, obviously, is health. We are never going to lose this as an initiative. And it is, as I said, that we want to look at how can we prevent illness, all right? So we have two new things going. One is that the committee is working hard to put together a resource guide that will be available of all the options, the kinds of programs, information about diet and nutrition and walking programs, very specifically on health. The second thing, I'm really excited about this, and we're going to really push it. There's a program, and it's statewide. It's called Food is Medicine.
Yay.
And the Brigham and Women's Hospital has now started a pilot program. Doctors are giving prescriptions to people. And they can take the prescription, and they can go to a grocery store. And they can't get potato chips, but they can get really good food that may reduce their weight, which may help them learn how to eat in a healthy fashion. So those are the two major things that we've been working on this year in that realm. The second then that we obviously need to work on is inclusion, okay? And this is really important. And two things that we are working on here. One is we put together a program called How to Communicate with Older Adults. And thanks to you and Dominick, we gave it to your department heads. I think it was very successful. People don't talk to older people the way they talk to other generations. I've also given it to the police department. I've given it to the staff at the Peabody Essex Museum, and we hope to give it to many more people, okay?
Yep.
The last thing I want to talk about is the thing that I am most passionate about and really committed to. And that is something you alluded to, age discrimination, ageism. It's rampant in Salem and across the country. And it is so detrimental to older adults. It affects their self-esteem. I don't know why people think that when we sit down at a table at a restaurant, they can call me honey, or call me girl, or call me, why don't they call me Patricia, or just bring me the menu, okay? And that's a very silly kind of example, but it really, when you get it day in and day out, can be really detrimental. So we are working on two things in relation to that. I think the main thing is that we've formed a group together who are going to advocate for dismantling age discrimination. There's 13 or 14 of us. People are more than welcome to join. If we need 2 or 3 groups, that would be wonderful.
Yeah.
And what we're doing now is we're reading. We're learning about what's out there in the literature. There's some wonderful books that are coming out. There's one called Ageism Unmasked. My favorite is This Chair Rocks. And we are then going to go to different groups in Salem and talk to them, because the truth of the matter is that older adults do this to themselves too, okay? If I were to forget a word, I might say, oh, Alzheimer's. No, 2 to 5% of the older adults get Alzheimer's or dementia. Come on. You forgot a word when you were 20, all right? And also, the other aspect that's a concern is that I want people to really be aware of the fact that they probably don't even realize it, but they are discriminating against older adults. So that's our latest effort, at least in terms of health and inclusion. And Dominick has a couple of others.
Yeah, I
important
really
ones.
want to actually highlight, come back to what you had mentioned, Mayor, around the Community Life Center, like the building that we finally created, working together as a community that was, I think, much needed and long awaited, and having the opportunity to break ground there and see that building through has been very exciting. As part of this second phase of Salem for All Ages, we're taking a very intentional look at the CLC and working with the staff there, working with the board of the Council on Aging, and again, always with some of our community partners to think about ways that we can collaborate to grow the programs there, identify opportunities to maybe change them or offer them at different times or in different ways to reach more people. So we've had a few surveys. We've done a number of focus groups facilitated by a professor from Salem State who's been working with us. Groups that are both people who attend the CLC and people who have never set foot in the building. We're looking at the Council on Aging and CLC website, the newsletter that they publish, trying different programs like the speaker series that's run for a few seasons now to help bring people in after hours who might not normally visit the building. So making the best use of that gem that we've created is a high priority in the next phase of Salem for All Ages.
I mean, it's really exciting to look back on all the work that's already been accomplished, but even, I think recognizing that we have more work to do and that there's a commitment to sort of carry this on. One of, the things that I'm most proud of is that we are always looking for this curiosity, this continuous learning environment. It's part of our culture. And so the work of Salem for All Ages, I'm so grateful for what we've done, the number of city staff who have participated in committee work, a leadership council, everyone who's committed time to the task force, all the work that over the last several years through the assessment to today has really contributed to the work of Salem for All Ages, and really want to encourage people who might be watching this show to get involved. Visit salemforallages.org to find out what's happening, to get a better sense of an initiative or something that you might be interested in. How can we serve you, or how can you get more engaged? When we began this discussion, several years ago, we made the decision to pursue this certification back in 2016 because it aligns so well with the priorities of our community as a whole. How do we think about, as a value system for our community, being a place that's livable, that's safe, that's vibrant, that serves everyone, no matter your age or ability. And that's exactly what the Salem for All Ages initiative has done. So I want to say thank you to the two of you for leading this effort, for priming that pump, for putting Salem on the map with respect to being an age-friendly place. Those values are really put into practice, and really looking forward to the work ahead in a way that's going to ensure we continue to be a place that is not only age-friendly, but involves the social inclusion, the accessibility, the transportation, the ability to be a transformational place no matter what your age is. So thank you for all you've done, and looking forward to many more years in this work going forward.
Thank you for your support. There's no doubt in my mind, and I'm sure there's no doubt in Dominick's mind, we would not be where we are today without your support. Most grateful.
Appreciate it.
Thanks.